Greetings from Citizen Health and the Team Academy IAPSME Connect. And today, in the series of People's Health It Matters, we have Dr. Manjit Boruah, who is an Associate Professor in Community Medicine, Gokharacharya Medical College, Assam. Once again, we welcome you, sir, on behalf of all the audience.
Thank you so much for giving me this opportunity.
And today we will talk about very interesting thing that we all have some medical instrument at our home, but we don't know the exact procedure. So today we have Dr. Manjit, who will tell us that how to use the thermometer, how to use BP machine, and how to use pregnancy testing kit according to the time available to us. So without wasting any more time, I want to know, sir, that how to use thermometer.
So thermometer mainly it is used to measure temperature, body temperature. So we have several different types. We have the mercury ones, and nowadays we have the digital ones. So mercury being a toxic substance, the mercury ones are gradually being phased out. So mainly we are now using the digital thermometers. So digital thermometer, again, we use mainly the oral temperature. We check the oral temperature, and sometimes also we use the auxiliary or armpit temperature because it is less accurate. And for children and very young child, we use the rectal thermometers.
So how to use it, sir? If we use it orally, I assume that it has to be put under the tongue.
Yes, you are correct, absolutely. So we have to put for oral reading, we have to put the temperature, the bulb of the thermometer under the tongue, keep it for a few minutes till the device beeps, then we take out and see the reading. And another important thing before that is the cleaning. Our hands should be washed with soap and water, and also the device itself, we have to clean it either with soap and water, or maybe we can use some alcohol wipe also. Then we have to wash it with water and use it. So cleaning is also important before taking the temperature.
Okay, and what about the reading, sir? How can we rely on that? How much we can rely on that?
The normal body temperature is about 37 degrees Celsius. So about 1 degree Celsius higher, it means we have a fever. So your question is that, I suppose.
No, sir. My question was that if we are using the digital thermometer, so how much we can rely on that? How accurate the reading is? That if it is showing like 38 degrees centigrade, so will it be okay, or there is plus minus some point?
Uh, Regarding the accuracy, I think we should see the owner's manual, because there are different manufacturers and they have different these things. And we should use the from good manufacturers, then we can get good accurate readings. Also another thing is that the battery should not be low, then also the readings get fluctuate, the readings fluctuate.
Okay, and second instrument which I am very interested in, weighing machine. If we all must have the weighing machine, but we don't know the actual procedure, medical procedure, that how to use it. Please elaborate, sir.
Okay, weight machine, nowadays everybody has the weight machine at home, and most of them now use the digital weight machines. Okay, so the correct procedure is, one is that you have to place the instrument in a flat and firm surface, not on a carpet or slight uneven surface, then the readings may get hampered. Then the person has to stand on the device with minimal clothing. And of course, before that, one thing has to be ensured that zero has to come on the device. Only after that, he should step on the instrument. Then he should wait till the reading stabilizes. Usually, he should actually stand still and look forward, and someone else may take the reading. If he bends and tries to see the weight himself, then there may be some fluctuations in the reading. So that is actually the correct method.
Any specific time to use this weighing machine?
Usually early morning, once he rises from the bed, then you can take. Best thing is that he should take it every day at the same time. Then it's better if he's following the weight for some purpose.
Okay, so our next instrument is BP machine.
Yes. So BP machine we use mainly to measure the blood pressure of a person. And again, like the thermometers, previously we used to have those mercury ones, but nowadays mercury is being phased out. So we have the electronic devices, automatic electronic devices, which we use to measure at home. So, regarding their use, some preparation is necessary. So, one thing is that if the person has done some exercise or he has taken some beverage like tea or coffee, then at least 30 minutes gap should be there. And before taking the measurement, the person should be seated and relaxed for at least 5 minutes. After that, only we should go for the BP measurement. Then another
Okay.
point would be the regarding how he sits. So he should sit on a chair with his back supported and his feet should be on the ground. And we take the measurement on the left hand, left arm actually, and his arm should be at the level of the heart. So some table or something may be given where he rests the elbow and we have access to the arm.
Okay, some people take this measurement when the person is lying. Is it correct, or should the person should be seated
Lying
only?
is also correct, sitting is also correct. So in sitting position, we take at the level of the heart. Arm should be at the level of the heart. So it's
Oh,
useful.
okay, okay. Next instrument is pregnancy testing kit.
Okay, pregnancy testing kit. It is used to see whether a woman is pregnant or not. And usually she goes for such a test once she misses her period. So the idea behind the test is that if the woman is pregnant, then the embryo it starts secreting a hormone which is then excreted in the urine. So that test detects that hormone. So regarding the procedure, how one should go about it. So these pregnancy testing kits are available in the pharmacy over the counters. So one may purchase the pregnancy testing kit. Then once everything is ready, then only the strips should be opened. So first thing is that urine should be collected in a clean container, kept ready. And some of the kits they recommend that it should be the early morning urine. So once you have the urine in a container, then you take out the kit, open up the kit, you place the card on a flat surface which is away from a means fan, not under the fan. Then you take. They have also provide a dipstick inside the kit. So using that dipstick not dropper. So with the dropper, you collect few drops of urine and put it in the card where the urine is to be put, 2 or 3 drops. Then you wait for the result, 3 to 5 minutes, and within 5 minutes you have to read the result.
So I have seen many confusions in reading the results. Both line darks, one line dark. When will it be positive?
Okay, there are two things on there. One is C and T. C is the control and T is the target. So the result is negative if only one line comes under C. Okay, control. If two lines come both at the C and T, then the result is positive. That means it is pregnant. The woman is pregnant. And if no signs appear, neither at the C nor at the T, that means there is some mistake and this result is not valid. And another thing I already told that you have to read the result within 5 minutes. If the lines appear later than 5 minutes, then also something is wrong. You may repeat the test or you may wait for a few days and do the test again.
Okay. And what if very faint line comes on T?
Fake line means we already talked. It detects the amount of HCG, the hormone secreted. So if the hormone is less, maybe we get a faint line. Again, the recommendation would be that you repeat the test, or you may start with the early morning urine.
Acha, after how much time a lady should test this? Like after skipping of periods of 2 days, 3 days, can she test, or she should wait for a week at least?
We are talking about the repetition, no?
No, no.
Repeat
For
test.
first check,
First,
first check.
first. Actually,
When
first is
well,
the time around when she misses her period.
hmm,
That means her period was means last mens was on 8th of this month. Now
Right.
again 8 has come, so that
Mm.
period has not been. So she
Right.
missed her period, and from that time she can take. Because
Take.
if we start before that, we may not get the result earlier
Okay.
if we do it early.
Okay. So my last instrument, sir, which we have used very frequently, that is glucometer.
Yes, glucometer. So glucometer, as you all know, it's a device which we use to test the level of blood sugar. And the advantage, of course, it takes blood from a small prick, not like the one used in the laboratory where a big vein is punctured. So less pain, and very easily we can do it at home. So we'll be talking about the procedure.
Yes, sir.
So yeah. So we know what are the parts of the glucometer. We have a pack of the strips which we use inside the glucometer. Then we have some needles to prick the finger for getting out the blood. So first thing is that we have to have the strips for the glucometer. And once we are ready for the testing, we take out one strip, and in some devices we have to keep it outside. Some devices we have to insert it in the glucometer device. Then the next thing is that we have to take out 2 drops of blood from the finger. So for that, one important thing is that our hands should be clean. I am thinking that I am doing it for myself. So hands should be clean. I will wash it with soap and water, or I can also use alcohol swabs to clean the tip of the fingertip. So one important thing here is that to get a good amount of blood, I should rub my hands together like this. So the more blood flow is there, and with a single prick, 2 drops comes out easily. So then second, and then next point is that I have to prick the finger with the lancet. So there is a lancing device inside which we have to insert a new needle every time. So once we insert the needle, then we can set the number. The higher number means more deeper is the needle prick. So persons having thicker skin, they should use the higher numbers. Otherwise, middle number is enough to get the drops of blood. And regarding the site, where should we prick? So usually we use the ring, this last finger, ring finger, and this in what do we call it? Index finger. These last two fingers we usually use, and we do not prick at the middle. We prick at the side of the uh, fingertip, at the sides. So these points are important. So we use the lancing device to prick. Then the drops of blood comes out, and we touch the drop of blood through the strips already inside the glucometer. Then we wait for a few minutes, and the glucometer will show us the reading. So that's in a nutshell about the process.
Okay, we need two readings, no, sir? Fasting and PP.
Yes, yes. That will depend on at what time I had my last meal. So right after I get up in the morning, I have not taken any meal since last night's dinner. So it would be
Hmm.
fasting. At least 8 hours fasting is recommended, and 1.5 hour, 2 hours after a meal. That is the postprandial, means after the meal.
Acha, generally we see that, sir, the test we do at home with the glucometer is a little bit different with the lab test which we do on in the lab. Why is that? And is the accuracy is good of glucometer at home?
Yes. At home, we are only doing a test, pricking the finger. So the blood that we use here is the capillary blood. Whereas in the laboratory that we do the test, they take out blood from a vein. So it is a venous blood. So because of that inherent difference, we get some different results. Also, the machines are a bit different, those that are used in the laboratory and those that is in the glucometer. So we get some variance in the results. However, if I'm using a glucometer from a good manufacturer, reputed brand, we can hope to get good results.
Okay, okay, sir. Thank you so much. Thank you so much for this informative session with us. Thank you once again, sir.
Yeah, thank you.